Hello, everyone. Twist. I'm not Theron Pry, but my name is TheaSebastian. I'm the founder and executive director of a nonprofit organization called the Futures Institute, which is dedicated to building safe, thriving, connected communities. For the last 4 years, I also have been leading a national coalition of 100 organizations across the country working to advance a federal community safety agenda. Over these last several decades, this country has made significant progress on public safety. Violent crime, especially homicide, is hovering near historic lows. In some places, such as Baltimore, homicides are down a staggering 40% over these last 5 years. That didn't happen accidentally. It happened because policymakers and community leaders, including people in both parties, have been investing in evidence-based community safety strategies that prevent violence before it starts and center community-based responses to crises. These strategies include community violence intervention, which uses trained professionals to prevent and interrupt violence. They include alternative crisis response that sends social workers to de-escalate mental health and other crises, providing critical relief to the thousands who have disabilities and who encounter police every year. They include restorative justice programs that address harm in a way that avoids prosecution and prison while bringing healing to survivors. And they include efforts to install streetlights, to remediate vacant lots, and otherwise to invest in the building blocks of safe communities. The plain truth is that these programs work. In some communities, CVI has reduced gun violence by as much as 70%. Alternative responders have caused as much as a 34% drop in low-level crime, while taking a major burden off of police, often thousands of hours, simply by diverting calls. And investments in the social determinants of safety, like jobs for teenagers, housing, and treatment, are our most cost-effective way and high-impact way to improve public safety while increasing economic opportunity. But right now, all of this progress is on the line. Last month, HHS announced a major restructuring and layoff of 10,000 people, including deep cuts to the agency that leads our research on preventing gun violence. It also included major cuts to SAMHSA, which oversees treatment for substance use and mental health, and to grants that prevent youth and community violence. And since then, leaked documents have suggested potential eliminations of key HHS programs that fund community safety across the country. While last week, though CVI received significant support in bipartisan bills, the Justice Department began terminating millions in grant funding to organizations like the ones that you heard speaking here today, that work on preventing violence, on providing victim services, and on providing other life-saving programs. Well, it doesn't have to be this way. It's easy to imagine a policy agenda that would embrace these game-changing community models. Indeed, that's exactly what the Community Safety Agenda, a legislative agenda endorsed by 100 organizations nationwide, introduced just last week, has to offer. We could create a division at the Department of Health and Human Services to scale these programs. We could create community safety departments in every single neighborhood. We could invest robustly in the social determinants of safety, summer jobs, streetlights, parks, housing, after-school programs, mentorship, so much more, that actually keep people safe. This is a time to move forward, not backward, while building a 21st century approach to safety. I am grateful to join allies like the ACLU and all of the other organizations and lawmakers here today in the critical fight to make this agenda a reality. Thank you.